Hi, I'm Dr. Trusser, and welcome to the Ignite Your Power workshop. Our mission and purpose is for you to dominate life and health. Let's dominate. Let's be powerful. Let's be healthy for our entire life. When we look at America today, according to the World Health Organization, the U.S. ranks 79th out of 81 in industrialized nations, according to its total health index. That's more heart disease, cancer, diabetes, infectious disease, autoimmune conditions, iatrogenic. We're going to cover that in a second. So, what is happening? Health in America, heart disease is the number 3 killer. Approximately almost 700,000 deaths a year. Cancer is right behind with 600,000. And you have to understand it takes about 8 to 15 years for symptoms to develop. They're building up inside of us, causing us to break down, and we don't even know it. And by the time we get diagnosed with heart disease or cancer, many times it's too late. 5 out of 6 Americans are dying from heart disease and cancer. This can be prevented. The number 3 killer in the U.S. today is our medical system, our medical care, medications, over-the-counter drugs, surgery, hospital care. 200 to 400,000 deaths every year. And many of us, not I, but many of us, many of Americans depend on this system because we know no other choice. Well, today, we're going to give you some other options. We're going to give you some other ideas. They just had a recent study, top 11 countries. This is the Commonwealth Fund report. I'll give you the website if you want. Healthcare performance ranks U.S. as last. 7 out of 10 deaths related to preventable diseases, obesity, diabetes, high blood pressure, heart disease, and cancer. 75% of Americans of our healthcare dollars are spent treating these diseases. Preventable diseases, things you can do something about. Affordability, U.S. is last. Pharmaceutical companies spend $5.4 billion in advertising and reap sales of $413 billion. This is a business. Spending, the U.S. is last. The average American spends more than $12,500 on personal health care, according to the most recent estimates from the Centers of Medicare and Medicaid Services. So there's the report. There's the Commonwealth Fund report. It's quite staggering that we are last in all these situations. The facts are 15 prescriptions per year are issued for every man, woman, and child in the U.S. Now you have to understand, I don't take any. My family doesn't take any. It's rare that we do. We have, but it's very rare. So where are these 15 prescriptions per year coming from? From children, from women, from pregnant women. This is staggering. 25% of adult Americans take an antidepressant medication, but the FDA's own studies say they're no more effective than a placebo, and exercise for 3 months was equally effective. 25% of teenagers report they contemplated suicide. 18% of kids have a developmental disability. ADHD, autism, blindness, cerebral palsy, hearing loss, learning and an intellectual disability, seizure, stuttering, developmental delay. Crazy. We spend $1 trillion worldwide on statins, the cholesterol-lowering drugs, and they only show an increase of life expectancy for 5 days. So my story. So here's my dad when he's about 45. I'm in that handsome brown shirt there. And when I was young, you may know my story when I wet my bed until I was 9, had chronic stomach issues from 4th grade all the way to high school, where it was chronic irritable bowel syndrome. And it was hard to even get to the bathroom in time, which I couldn't many times in high school. I had allergies and sinus, and I was taking all these over-the-counter medications. Yet I was an athlete. I was a very good athlete in school, one of the top athletes. Yet I was sick inside. This didn't make sense to me. So one day my back flared up on me. I couldn't move. I went to a chiropractor. He adjusted me, but he didn't explain what we're going to explain to you today. And he said to me, Aaron, if you're in pain next week, come back. Mr. Trusser, if he's in pain, come back. My dad had heart disease. And at that time, he was 47. He couldn't walk more than 50 50 feet, 50 yards without catching his breath, bending over and panting because his heart was so bad. He was on all these medications. He eventually had surgery at 50, and a few months later, he died of a heart attack. So nothing worked. At 50 years old, my dad died. And what I'm going to show you today, after I learned what I learned, it completely transformed my life. I went to chiropractic school. My back pain went away immediately, but all my sickness completely disappeared. I have not been sick like that since I was a kid. And I still play competitive sports. I've had many injuries. I still play competitive rugby. Right now, I'm 57 years old and I'm playing with 20-year-olds. So my body has maintained itself and I'm thriving with health. You can do that too. Whatever you want in life, you can regain that. But we have to look at health a little different here. Are we in a health paradigm? Are we in sickness care or are we in wellness care? Sickness is just drugs, surgery, crisis care. That's where most people stay. Just go day to day and hope, keep their fingers crossed that they're going to be okay. Wellness care is prevention, lifestyle changes, how you exercise, how you eat. The body is self-healing through the nerve system. We need to maintain that. Gray's Anatomy says health is function. It's not just pain relief or feeling good, it's function. Function occurs through the central nerve system. Look this up. So we have to look to the nerve system on how we're functioning. There's my youngest child, Aaron, and my youngest grandson, Gideon. And each of them have anywhere from probably, Gideon would have much less, but 25 to 37 trillion cells in their body. How did they know to organize every organ, cell, muscle, and bone in the right place? And then maintain it every day. We don't think about our heart beating. We don't think about our lungs breathing and our red blood cells redeveloping every single moment of the day, and the bacteria in our body getting eaten alive because of our cells. We have an innate intelligence. We have an intelligence in our body. All life contains innate intelligence, and this force is responsible for the organization and healing of the body. So how does this innate intelligence work? And where does healing come from? Healing comes from the brain and nerve system. It does not come from food. It does not come from exercise. Those things support it. But healing only comes from the brain and the nerve system. This is innate. This is automatic, inborn. That's why we named our office Innate Life. We have an innate or inborn ability to heal. When we cut our knee, we don't have to think about healing. It heals itself. When we eat some food and it goes into our stomach, we don't have to think about digesting and turning all those nutrients into muscle tissue, eye tissue, organ tissue. It does it automatically, innately. We were born with this healing power. We don't lose it as we age. The question is, or do we? As we age, we see people getting sicker and sicker and they can't heal. Is it aging, or is it we're blocking this healing power every year, and the damage accumulates in time? That's what happens. We don't lose it as we age. We should be healthy until the day we die. We have 100% power to heal. We interfere with its connections and output. That's why as we age, we get sick. We interfere with it through subluxation, poor diet, chemicals, emotions, and the decay of our spine and nerve system. We were born with this incredible power because we were born in God's image. We should be powerful and healing. So this is a crawling neutrophil chasing a bacterium. Look how powerful and incredible this is. This is happening inside of us right now. Every day, every moment, that little bacterium is trying to get away, but the body's innate intelligence knows that it's harmful, and it knows that it's got to get rid of it. It's got to capture it right there and then dissolve it. Incredible. That's happening without you thinking about it if our body is in proper alignment and our nerve system is working properly. So Dr. Ronald Piro, Preventative Medicine Institute Cancer Prevention Research, said that patients, he did some studies, he found that patients who had regular chiropractic care for at least 5 years had a 200% better immune response than those who didn't. 200% better. And those who had serious illness, The chiropractic patients had a 400% higher immune function. A fever, good or bad? We know that a fever is born, it develops innately and naturally when we have an infection. Infectious fever increases gamma delta T cells that defend against cancers. A fever is a good thing. So if you never get a fever, allow that fever to develop, we never develop these gamma delta T cells that defend us as we get older. We want to have these cells to be able to defend off cancer. Another study in 1994, the year I graduated from Life University, and I remember this study while I was there. They had a study with HIV patients. Those who received adjustments had a 46% increase, more CD4 cells, these are the immune cells, than those who did not. Those who didn't get adjusted had an 8% decrease. I remember this study going on, and they actually stopped the study, and we were wondering why. And they said they didn't feel it was fair to the people who didn't have the opportunity to get adjusted. So they allowed them to get adjusted. What an incredible study. Patricia Brennan, researcher, immune system research, enhanced phagocytic cell respiration burst. I know, a lot of words there. White blood cells induced by spinal manipulation. When you get adjusted, you have a 200% burst of immune cell activity immediately after an adjustment. That's why when you're feeling sick, get adjusted. Don't wait. And don't wait to get sick. But if you are sick, that's a great time to get this burst activity, to get this healing activity. This is an incredible study in the early 1900s. Dr. Henry Windsor from University of Pennsylvania Medical School dissected 75 humans, 72 cats, and it got published in Medical Times. He found that there was a nearly 100% correlation between minor curvatures of the vertebrae and diseases of the internal organs, meaning wherever that spine went out of alignment, that's what they died from. Heart disease, T1 through 5. And if you blow this up or you look at a chart, you'll see that's where the nerves from the T1 through 5 go to the heart. The stomach, T5 through 9, pancreas, kidney, uterus, lung, liver, spleen, prostate, and bladder. Wherever the spine broke down, like if it were the lumbar spine, the low back, people died from prostate and bladder disease. Incredible. That's why chiropractic care is so essential. And that's why an x-ray is absolutely critical, because you don't know if the spine has a curve by just looking at it or feeling it. The central nerve system is essential. It's primary. Diet, exercise, supplements, thoughts, they're all secondary. They're important, yes, but they're secondary. Where do we put our hope many times? We buy some supplements from Walmart or from the store and think, that's what I need. And then we go for a walk, or we change our diet. Those are all great ideas. But don't neglect your central nerve system. Don't neglect your spine. Is there any organ, gland, or cell that isn't connected to the nerve system? They're all connected. That's why spinal alignment is vital for nerve flow and organ health. Without normal alignment, you're not going to have normal output. So when we look at an x-ray, this is a neck. This is a side view of the neck. And there should be a bend in it like a banana. What happens when it goes out of alignment, it looks like this. It straightens out, doesn't have the curve. If it stays there long enough, that could be anywhere from 5 to 15 years, we develop arthritis, degeneration, disc degeneration. This is dangerous because the nerves are being compressed. The spinal cord is being compressed. That's like in this mid part of the neck, it goes directly to the thyroid. Those nerves go down the arms and hands. They go into the shoulders. They go up into the head for head control, headaches. They go into the sinuses, to the throat, to the tonsils. Man, there's a lot involved. Subluxations block nerve flow. You can see on the right there the red nerve. Then when that bone shifts out of place, it pinches that nerve. That will cause arthritis and degeneration over time. And the problem becomes chronic and permanent if you don't get it realigned. That's why we x-ray. So when should we make sure the spine is in proper alignment? Should we wait until pain starts, when a symptom starts? Well, symptoms start when there's 60% function. That means there's 40% damage to the spine, to the alignment, to the organs, to the tissue. Person having a heart attack, they've already had 40% damage of workup, maybe for 5 to 15 years, and bam, same with cancer. So when does this start? Starts at childbirth. Pulling and twisting can cause suboccipital strain right at where the skull meets the neck, because that's how they pull. This is a C-section. They pull babies like that. Can that traumatize the neck? Well, Dr. Gutmann, an MD in Germany, said that 80% have cervical strain at birth. Dr. Taubman, an MD at Harvard, related neck strain, subluxation, is related to sudden infant death syndrome. This is critical, folks. And so we may have had this at birth. Your child may have had this at birth, and they're doing fine. They're running around playing. But are they? Are they out of alignment? Are they going to have breakdown in another 5 years or 10 years? Do they already have ear infections or chronic tonsil problems or sinus issues or headaches or concentration problems? Well, Dr. Heiner Biderman, an MD from Germany, minor birth trauma can lead to headaches, postural problems, sleep disorders, unable to concentrate by the age of 5 or 6. So for those first few years, they may seem okay, but if they had this birth trauma, they need to get back in alignment immediately. And he says manual manipulation and adjustment is the best way to treat it, and should be done with x-rays. That's why we x-ray the spine. So what if your child is subluxated? Did you know that 70% of development occurs in the first 17 years, and then it's locked in? Man, this is critical. How do they develop? How do they develop emotionally, neurologically? How does their brain develop? How about posture and structure? What about future development? So if they're subluxated in these first 17 years and this locks in, all these issues of development will be delayed or damaged or injured. Never be the same. That's why we offer a free evaluation in our office for kids, for family. We don't want to leave any kid unchecked. This is crazy to just let it go and wait for symptoms to develop. So here's Trevor. He came to us when he was just 5 weeks old, and he had acid reflux. And when he came in, he was on Zantac. After his third adjustment, he was off Zantac. Did you know that Zantac got pulled from the market because it's related to cancer? It causes cancer. Well, he sleeps well and he's doing great. Trevor now is in 6th or 7th grade. He's taller than me, and he's doing absolutely fine. So we look at this x-ray. What's wrong with his neck? It doesn't have the curve. When this little boy came to us, his name was Colton. He was 2.5 years old. He was delivered by suction. Well, Colton was given 2.5 years to live because he was developing bone tumors. His kidneys were shutting down. He was a very sick child. The parents didn't know what was going on. They had him to Johns Hopkins, and that's what Johns Hopkins diagnosed. The diagnosis was unknown, but he was dying. When they came to us, we looked at that, and I knew I couldn't make his bone tumor stop or his kidneys work by just some magic potion or a vitamin. I had to correct that neck. For his ability to heal properly, we had to change that neck. So when we did his first x-ray to his second, look at the change. That was in just a few months. And in a few months, he was stable. Everything was good because he had a horrible rash all over his body. He was on steroids almost every day of his life. And by the time we took his second x-ray, he wasn't taking his steroids and he was stable. And we continued doing less adjustments, but we kept this in alignment. Within 5.5 months, he completely healed. Colton, this is when he was 10. He was in 4th grade. He was in the honors. And now Colton's in his 20s and he's doing fine. Chiropractic care changed and saved his life. Brennan, chronic ear infections. A very similar story with many of our patients. Now, when we look at his first x-ray, the upper part, where that arrow is, that upper bone should be angled upward. As in the second x-ray, you can see how it's starting to angle back upward. Well, that's putting brainstem pressure. And right below that, the second and third vertebrae are actually bending backwards. Brainstem pressure, this goes right to the ears. Well, as we corrected his curvature and his alignment, his ear infections were gone. He never got them again. This is quite sad and quite disturbing, but this is what can happen. This boy, he was a patient of ours, and he still is at age 11. He had a 28-degree curve. He was getting adjusted regular. But he didn't like getting adjusted. He didn't like coming in, and he complained. So his parents just left him, um, stayed home. They didn't keep him under care because he didn't complain. He didn't want to come in. And at age 17, we just did this x-ray recently. He has a backwards curve in his neck. It's -5. He only gets adjusted 3 to 5 times a year at best. Why did that happen? He was still getting adjusted, not what we recommended. Why? Because it's called tech neck. It's called computers, cell phones, technology, sitting at a computer all day at school. This doesn't do it every time, but it can. Your child needs to be checked to see where they're at. Do they have this curve? And then if they do, how to maintain it. If they don't, you've got to get the pressure off that spinal cord nerve system, or it's going to cause severe destruction later on in life and early death. What generates the most healing power? So Dr. Ronald Speary, he's an MD, a neuropsychologist, neurobiologist. In 1981, he was a Nobel Prize winner. What he found was 90% of stimulation and nutrition to the brain was generated by movement of the spine. It needs to be moving properly. It needs to be in alignment and flowing so the energy and the nutrition to the brain is restored. Otherwise, Alzheimer's, dementia, Parkinson's, where all these diseases come from. Get adjusted for life. Keep the spine in alignment. Benedetto, it's 6 weeks we had him walking. He came in a wheelchair. He had surgery for a tumor in his spine. They messed him up and they said he'll never walk again. We said, baloney. We adjusted his neck and his back, not even his low back. We removed the pressure. He did the therapy he could in his wheelchair, and one day he stood up on that platform. In 6 weeks, he began to walk with a walker. In 8 weeks, he had a cane and he was fine. Dr. Rene Callier, an MD, researcher, found that forward head posture, this is your head goes forward from tech neck. It increases heart and lung disease, and it can decrease life by 15 years. Now, look at where this curvature is, right in the upper back. Look where those nerves go, to the heart and lungs. Isn't that incredible? 15 years of our life because of heart and lung disease. That's the same thing that Dr. Henry Windsor said in his studies in the early 1900s. Journal of Manipulative and Physiological Therapy, a 7-year study. Patients whose primary physician was a chiropractor. That's interesting. Their primary physician. They didn't want to go to the MD. They had 60% less hospital admissions, 59% less days in the hospital, 62% less outpatient surgeries, and 85% less in pharmaceutical costs. This is incredible. So, are you ready to ignite your power? Your spine and nerve system are your power. You have to keep it in alignment. I encourage you. 1, if you're getting adjusted, keep it up. If you haven't had your family checked, get them checked now. Get them checked. Get their spine evaluated. You can do whatever you want with the information and the knowledge, but without the knowledge, you're just laying as a dead duck. And if you haven't, get adjusted, do your therapy at home, do what we're telling you to do, and improve this system, and then apply those other things in your life, like your lifestyle choices. But without your spine being optimal, that's essential. That's the most critical thing. You're always left wondering. Thank you. And please share this message with your friends, your family. Post it on your Facebook page. Send it out in an email. Give it to anyone. We want this message to spread around the world. We want to dominate health in our community. We want you to dominate health in your life. And we want our families to have dominant health in life, just like mine is doing. Thank you, and God bless.